Hello and welcome to South First. I am Chetna Belgere. Today, in our webinar series, we'll be discussing a topic that affects millions of people but is often dismissed as just snoring: obstructive sleep apnea. If you've ever woken up gasping for air or being told you sound like a tractor at night, this session is for you. With over 10 crore working age Indians facing sleep apnea, this isn't just a nightly disturbance, it's a serious health issue. First, let's find answers to some basic questions on sleep apnea and then move forward with associate problems, treatment options, etc. Today we have with us Dr. Ramakrishnan, Senior Consultant in Critical Care and Sleep Medicine at Apollo Hospitals, Chennai. Doctor, welcome to the show. And my first question to you is, what is sleep apnea?
Sleep apnea is, as you said, a very, very common disorder that's often ignored. And the warning symptom that's noted is usually snoring, which several people who are snoring may not be aware that they are snoring, and it's their bed partner or somebody else who observes that they are snoring. What is happening in sleep apnea is the air movement through your air passage when you're breathing in or out is kind of obstructed for various reasons. It may not necessarily be a physical obstruction, but it's often due to what we call collapsing of the muscles of the air passage that's reducing the air entry to the lung. And therefore, your breathing sometimes slows or sometimes even stops. So when the breathing stops, it's called apnea. And when the breathing slows down, it's called hypopnea. What happens in either of those cases, whether the breathing is slowing or stopping, is that the oxygen level comes down. And that can have various effects on your system, which I'm sure we will all be addressing.
Okay. Doctor, if you could tell us, what are the warning signs of sleep apnea?
So I would broadly say that these are, like nighttime symptoms and daytime symptoms. And the nighttime symptom, the predominant one is snoring, which, as I said, it's invariably observed by others. Sometimes people feel their own snoring, which they describe as either choking or, like the bed partner may say that the snoring is suddenly stopping and they stop breathing. And they may wake up with a choking sensation, often with some dryness in their throat, primarily because, like their mouth breathe at that time and therefore their mouth feels dry. Some people can have what we call nocturia. They wake up frequently at night to use the restroom, and that could be another symptom. The more important symptoms are the daytime symptoms, where these are people who often claim that they don't have a problem with sleeping because they say, I sleep through the night and I'm told that I'm snoring. So they think it is sound sleep, when in fact it's only sound making sleep. It is not really a good quality sleep. And when they wake up in the morning, uh, they feel that they are not refreshed. So they describe it as a non-refreshing sleep. They wake up often with a headache, feel tired, fatigued during the daytime. Sometimes, when they're just sitting and not doing anything significant, they may feel sleepy. Then it gets to the point where even when they have to focus, whether they are at work or attending a meeting, they may fall asleep during that time. Some people even sleep when they are driving, which could be dangerous not only to them, but to people around them who are driving as well. So, daytime sleepiness is another significant symptom. More importantly, because of the lack of oxygen, some people complain that they're irritable during the daytime. Some of them have memory loss. So these are all some of the common symptoms. So if somebody is snoring and they've been observed to stop breathing or they are choking and they feel fatigued or sleepy during the daytime, time to get it checked to see if they have sleep apnea.
Okay. So we're joined by Dr. Ravi Mehta, founder and director of Vayu Chest and Sleep Center in Bengaluru. Doctor, you have a specialized lab to diagnose and even treat this condition. So could you please tell us what is the main cause of sleep apnea?
So, sleep apnea, by and large, has been related historically to weight gain, obesity. That's the strongest correlate we have with sleep apnea. And because we're going through a pandemic of obesity, I'm sure you'll be doing a meeting on obesity sometime or the other. The sleep apnea incidence is rising exponentially. And it's very logical. If you put on weight, basically, then you put on weight in the airway area. And as Dr. Ram was trying to say, by and large, the airway is narrowed. We basically become like a Bangalore road at 5:30 p.m., where it's all choked up at night. And because of that, all the symptoms occur. So fat or obesity leads to accumulation of this over here. And with age also, the muscles become floppier. There's a lot of anatomical things which Mother Nature changes as we grow older. So obesity, major reason for increasing sleep apnea right now, and it's going across the board. As you well know, children, adults, even the elderly, we're seeing a whole explosion of obesity. And because of that, the sleep apnea incidence has also risen. The second is, of course, age also. We find that in women, especially before menopause, they're protected somehow from sleep apnea. But postmenopausal women have the same incidence of sleep apnea as males. The third is male gender. Well, not all good things happen to males. So we itself, there's a higher incidence of sleep apnea in males because of the structural way which, the anatomy has been built. So end of the day, this part is vulnerable. Anything which narrows this part over here from nose to back of the throat to the tongue area and all, if there is any compromise, is a risk factor for sleep apnea. But for common people, it's by and large obesity. There is a gender part of it. And then last is, of course, structural part. If Mother Nature made you in a way that you have a nose which is shifted slightly to one side, only Cleopatra had a perfect nose. Everybody else has issues. If you have a big tongue, if your jaw is in a little unusual configuration, and this is seen in the Northeast population, all of it can compromise the back of the throat, which is the airway, and can be a risk factor for sleep apnea. So it's a whole science by itself, but in a nutshell, that summarizes most of the common risk factors.
Dr. Ravi, how do we actually diagnose sleep apnea? Like, are there any particular tests that we do to actually diagnose this condition?
So everything in medicine goes through first clinical and index of suspicion. As you started the webinar and Dr. Ram added, it's snoring. So snoring used to be lovely before. In the times we grew up, if you snored, you were sleeping well. But turns out snoring itself may be okay, but snoring associated with airway collapse is sleep apnea. So the symptoms and signs of the patient, which were mentioned by Dr. Ram, are the clinical indicators of sleep apnea. So loud snoring, stopping breathing at night, which is often perceived by a partner and not by the person themselves, very rarely by the person themselves. Basic thing is not feeling rested after sleeping at night. So if any one of us is getting a good 7 to 8 hours of sleep, but you're not feeling refreshed, then you have to look into your sleep problem. And one of the major things is sleep apnea. And then all the other symptoms are related to this poor sleep at night. So poor sleep at night is like sleep deprivation, right? I have put in 7 to 8 hours, but I don't have quality of sleep. So I'm tired, I'm non-refreshed, I don't wake up feeling fresh. I have to drag myself out of bed. My attention, am I feeling not too great? I'm not in my peak of performance. As the day goes by, I am feeling like I need a nap. Napping in the afternoon, or falling asleep while listening to lectures, computer, driving. And then towards the day progresses, I get more and more tired. Over time, all the psychological aspects, which I think you will get into, come in. And overall, it basically messes up your life totally, because one third or one fourth of your life is sleep. If that is poor quality because of this entity, then it messes up your life totally. And then, of course, we can go on and on, but there is tons of medical repercussions which come with it, which is the reason why this entity is not only been very important, but again keeps coming to center stage.
So, are there any lab tests that involve to diagnose this condition other than the clinical symptoms that you've just spoken about?
Absolutely. So, yeah. So to add to what you asked earlier is that once you suspect sleep apnea, there is a bunch of scores and all done, which is part of the clinical matrix. And then you have to do a study, an actual study, and God bless technology over the last 2 to 3 decades, where you can measure this. You can measure flow. You can measure oxygen saturation. You can measure what the patient's chest and abdomen is doing for efforts. So all that is done, and you can even measure brain waves by means of technology. So all this happens by means of a sleep study. So once you suspect sleep apnea, you do a sleep study. Now that also is a science by itself. Which sleep study is important? Some are done in the lab. In the last decade or so, they're also done in home in a lesser form. But that's a clinical thing. At that point, one would rely on the advice of a doctor or sleep specialist to guide you. But the answer in 2 words is sleep study is important for diagnosis of sleep apnea, not only to confirm, but judge the severity, look at other factors such as oxygen fall and all it was mentioned, and to have a baseline to work with for all the right reasons of therapy.
Okay. So, Doctor, we are also joined by Dr. Sudhir, consultant neurologist from Apollo Hyderabad. Dr. Sudhir, if you could, we all know that good night's sleep is absolutely important for us to function well through the wake time. Like doctors, Dr. Ram and Dr. Ravi already told us about how difficult it becomes in the morning. I mean, you don't feel fresh about things and all that. So, if you could tell us potential health risks of untreated sleep apnea, and is it okay to live with sleep apnea?
Yeah, it's a very important question. So basically, sleep apnea, the symptoms like snoring, it's a smaller hassle for the patient because it only affects the partner's sleep quality. But there are much more severe repercussions of sleep apnea because the nighttime sleep is disturbed. So it leads to excessive daytime sleepiness, and that can have impact on the day's performance. So the person is not able to focus in the work performance and the output reduces, and there can be accidents because they are not able to drive carefully and they cannot make decisions. So these are all the short-term effects. Now, if you look at the long-term effects, they are the more dangerous ones because people with sleep apnea, they have a higher risk of multiple diseases. Right from hypertension, they have a higher risk of hypertension, atrial fibrillation, even cardiac failure, strokes, heart attacks. So you name the serious diseases, all of them are higher in people with obstructive sleep apnea. And then as a result of all these things, even their longevity is also lesser than people without sleep apnea. So if you look at, these are the multiple effects of sleep apnea on the person, both short term and long term.
Okay. Dr. Ramakrishnan, if you could tell us, in India, normally what happens is snoring, like you said, is considered as maybe a nuisance or sometimes even made fun of. And it's never taken so seriously as a condition that can actually be leading to several health issues as well. So, how do we actually differentiate regular snoring and snoring that is of concern? You did tell us in the beginning on, some of the symptoms to watch out for, like stopping of breath and all that. If you could just in simple words, give us how do we differentiate between these two?
So some of this may sound repetitive, but I do want to say that not everybody who snores has sleep apnea, but everybody who has sleep apnea will be snoring. If that's the simpler way of understanding. Now, when somebody is snoring, as I said, if they are witnessed to have pauses in breathing, if they are stopping breathing, if they are choking, that itself is kind of suggestive that they are likely to have sleep apnea. The effects of sleep apnea, whatever happens in night, the apneas and the hypopneas and the oxygen level coming down are more reflected in the daytime. So if somebody has daytime symptoms like daytime headaches, irritability, daytime sleepiness, daytime fatigue, then all those are pointing towards sleep apnea. Now, I do want to add a couple of things to what the other panelists have also mentioned. Number one, yes, obesity is a risk factor for sleep apnea, but in India, we find a lot of non-obese obstructive sleep apnea. And the reason for that is our facial structure, as Ravi already mentioned about it. What we call craniofacial changes, something to do with our mandible, how it is structured, and also a lot of what we call central obesity, like where particularly middle-aged men having, like more of obesity that is centrally distributed. So instead of looking for obesity as a body mass index, it is recommended that we actually look at the neck circumference and the waist circumference. Those are more, then the chances of having sleep apnea are higher. So if any of these symptoms are there, then this may not be plain snoring. You need to think about sleep apnea. Another common thing that we get referrals for is if somebody has uncontrolled hypertension, uncontrolled diabetes, heart disease, heart rhythm problems, then if they are snoring, then they may have sleep apnea, which we need to look at. It's been clearly shown that people with sleep apnea, if untreated, can have or can develop high blood pressure, or if they already have high blood pressure, may start requiring more and more medications until you treat their sleep apnea. Same is true with diabetes. If you have diabetes, if it is not controlled, and if the patient is snoring, think about sleep apnea and look for it. And to distinguish whether it is just snoring or sleep apnea, the only way to do that is a sleep study. And there are different types of sleep study, which Dr. Ravi Mehta already mentioned.
Okay. So, Dr. Ravi Mehta, I'm coming to you on the sleep study. So, is it necessary that this sleep study is done overnight? And is it necessary that it has to be done in a lab setup only, or can it be done at home as well?
Right. So sleep study is important. There's no doubt about it. And there've been a lot of movement on trying to say, do we really need it? What do we do? Is there simpler versions and so on? But that's an eternal discussion. Bottom line, you need to actually verify the existence of this disease by a proper test. You just cannot only say that I think this is sleep apnea and treat it. That would be violating most of the principles and the directives of science and medicine. Now the question comes, I don't want to go to a sleep lab. I like my own bed. I don't want to go there and blah, 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 and so on, which is often an issue. So for that, a lesser level study where you don't monitor as much. So in a conventional sleep study, you go a full Monty, where you're monitoring a whole bunch of things from brain waves to flow to movements and to chest movements and saturation, and that gets very technical. So a lesser level, a dumbed down version is done at home, which is okay for people where the suspicion is very high. So if your suspicion is high and you're looking to check the box and confirm it, then it's okay to do this called what's called a home sleep study. So those are the cases which qualify. But if there's any worries that these people are, have heart issues or some any major comorbidities or can't actually do this or the data may not be good, it's probably better not to do this and do an in-lab study. So these two options are available. Again, a savvy provider decides which way to direct the patient. The patient obviously has to be told the pros and cons of each, and then accordingly a study is done to try and go ahead. Sometimes you also find we do a home study and it's not enough. We don't get the data we want or something goes wrong, the leads drop off because they're unattended. Please note that the home studies are unattended. It's a gizmo going on and then there's nobody at you. You just, are lying down with that and recording is happening. While in lab is attended. So like I said, again, there are reasons to do both. And accordingly, a good doctor will be able to guide the patients on which way to go.
Okay. So, Dr. Ram, if you could tell us on the advancements and, is it, does treatment for sleep apnea is invasive? Is it invasive treatment or is it non-invasive? How does that work? What are the treatment options?
I always tell people that obstructive sleep apnea treatment is almost like being an ophthalmologist when you can't see well. If you can't see well, your options are either wearing a glass or wearing contact lenses or having a laser surgery or some kind of surgery. And of course, they may teach you how to avoid stress and strain on the eyes with some exercises and stuff. Similarly, as of today, there are no medications to treat sleep apnea. Of course, you can treat the coexisting problems, like if obesity is the issue and you're treating obesity with medications or that's a whole different thing. From a sleep apnea standpoint, there are no medications to treat. So your options are what we call some oral appliances, which are often made by dentists, which can advance your mandible and therefore help you prevent snoring and treat sleep apnea. There are some surgeries which are often done by ENT surgeons in an attempt to open up the air passage in the back. There are different procedures they can do. They can remove what we call the soft palate. They can, clear up the nose if there was some, what we call hypertrophy of the soft tissues and all that. So those can be addressed as surgical methods. Now, the third and the most often used one is what we call CPAP, or continuous positive airway pressure. Basically, what this is a machine connected with a tube and a mask. And what the machine does is it's continuously blowing positive airway pressure, CPAP. So the pressure is opening up the air passage, and therefore the breathing gets better. The person doesn't snore. The person doesn't stop breathing. They wake up feeling a lot more fresh, and the daytime symptoms improve. And if they use it regularly over a period of time, it also helps with the other long-term medical problems, like if their blood pressure is not controlled, that would get better. Same thing with diabetes, heart problems, and any of those. So the treatment options are, number one, of course, is weight loss. There are some data saying maybe yoga, breathing exercises can help, but these are not going to treat the sleep apnea totally. It's going to help you with the management. And along with that, you may have to use oral appliances or surgery, which is usually recommended if the patient has just snoring or mild sleep apnea. But if they have moderate or severe sleep apnea, And if they are having daytime symptoms or if they are having comorbidities that are not controlled, then it is recommended to use the CPAP every night.
Okay. Dr. Sudhir, my question is to you. Have you noticed, when you have patients coming to you with a lot of neurological, issues and things like that, have you noticed a correlation with sleep apnea in cases like that?
Yeah, definitely. See, what we find is that many of our patients who come with stroke and also when they are a little bit obese or overweight, so many of them have coexistent sleep apnea. Now, sleep apnea can be a cause or a risk factor of stroke also. And people who get stroke, they have muscular weakness also. Like somebody with a brainstem stroke, they will have weakness of the oropharyngeal muscles, and that could lead on to sleep apnea. So there is a close linkage, and there are a lot of other neuromuscular disorders like myasthenia gravis, and few other chronic conditions which can also increase the risk of sleep apnea. So that is definitely one of the factors. And sometimes people just come with meaning migraines or headaches, and they may not realize that those headaches are getting triggered because of sleep apnea. They haven't slept properly, or the previous night, and the next day they come with headaches. So we have to sometimes inquire about that, and we have to have a high degree of suspicion, and then we can pick up this case of sleep apnea and treat the root cause. And then migraine also gets treated instead of just starting anti-migraine drugs. That may not be the best solution.
Okay. Dr. Ravi Mehta, I wanted to ask you, is there any way to even prevent sleep apnea?
All the risk factors which lead to sleep apnea need to be modified. Now, you cannot change your anatomy. That is the way the good Lord made you. So the ones who have anatomical sleep apnea because of a pathway issue, my nose or my back of my tongue or the throat or the muscle tone, you can't really help it. But the single most important thing is to avoid being overweight or obese, because fat accumulates over there and leads to a further narrowing of the airway. So by and large, it's going to be avoid weight gain or lose weight if you have sleep apnea, as was already mentioned earlier. Beyond that, simple tips are given. For example, we believe that most sleep apnea is worse when you sleep on the back. So sleeping on the back for a lot of people with sleep apnea may not be good because it flops and falls behind, and again you get narrowing. So it's a very mechanical issue. We keep on telling people it's actually like your highway only, and this is getting narrowed with traffic or footpaths being too big. And if you're not breathing well, traffic gets congested, and that has so many problems. So again, coming back to those who sleeping on your back is one of them. Sleeping on the belly also after childhood, actually, it's never really been recommended strongly. So these are the few tips by and large which are there.
So you suggest that they sleep on the sides? They turn.
No, so basically it all depends. There's a small entity called positional sleep apnea, Chetna, where some of these people by data are worse on the back. So if I give a global thing, I'll tell people, yeah, sure, don't sleep on your back. But there's people who will wind up and tell us, I can't sleep on the side. So, but if we find on the sleep study, which actually documents which position your sleep apnea was worse in. So there's a term for it, and we're getting technical. It's called POSA, positional obstructive sleep apnea, which is also debated because at the end of the day, this is a mechanical issue. So those people will be told to avoid the back. And in the past, there used to be fancy strategies like putting a tennis ball, sew a tennis ball to a t-shirt and put it behind so you never sleep on your back and go on the side. So some such solutions have been talked about. And the third is slight elevation of the bed may also help a little. So these are strategies which are of a mild nature and may be supportive. But by and large, the only way to prevent sleep apnea is either to be born correctly, which is not in your hand or mine, or to prevent, avoid being overweight, which is going to be adding to your risk of sleep apnea.
Okay. So this is a quick question for all of you. If you could just give us, Dr. Ramakrishnan, we'll start with you. If you could just, if somebody is diagnosed with sleep apnea, or even if somebody thinks that they have sleep apnea, is there something that they should consider when they're traveling or staying away from home?
Before I answer your question, if I may just add to what Dr. Ravi Mehta was mentioning, one other thing that I would suggest is reducing or stopping alcohol consumption, because alcohol has clearly been shown to worsen sleep apnea. And in fact, people who consume alcohol on the nights of consumption are snoring worse than usual, which is observed by the bed partner. And those who are, having significant alcohol consumption, if they can reduce or stop, would definitely help with sleep apnea. Now, with regards to the travel question that you were asking, Now, if I may understand your question, are you asking about how to deal with the snoring and like others commenting
Is
on
there
it?
no, I'm asking you, is there anything if they should take special care about when they're alone, when they're, if they have been diagnosed with sleep apnea and they have not really, done taken measures to correct it or whatever, then, is there something which they should be really worried about, careful about when they're traveling and sleeping alone in
Okay. So basically, during the night when they are having apneas, their oxygen level is dropping, which could potentially be dangerous. Their heart rate can change. Dr. Sudhir was mentioning about heart rhythm problems. Sometimes they develop what we call bradycardia. The heart rate can slow. All that can potentially happen. So untreated sleep apnea is a risk, and people are known to have worsening blood pressure at night, heart attacks at night, much more common at night if they are having obstructive sleep apnea as well. So I think all this needs to be explained to patients, saying and making them understand the need to treat. It is not just during travel. In fact, even once they start using the CPAP, a lot of them ask, "How do I take it? How do I carry it?" Definitely we do recommend that they use it as much as possible, even during travel. So I would say that if you have sleep apnea, forget travel, forget at home. You are at risk for health problems, and therefore you need to be treated. And I would focus on that rather than just saying what precautions can I take during travel. Often people come to us only because while they were in a flight, the co-passengers were complaining, or while they were in a train, somebody was complaining about it. And some people even video record and bring it, saying that this is what they showed me, and that was scary. So I think the focus should be on diagnosing and treating rather than just doing minor measures to prevent.
Okay. Dr. Sudhir, you want to add anything to this?
I think most things have been covered. So the most important thing is to focus on the weight because that is the most important risk factor. Alcohol and smoking also have been mentioned. So because prevention is better than cure. So there are three things I would like. Also medications. Somebody on sleeping pills, they also have a higher risk. So we should look at that.
Okay. Dr. Ravi, you want to have add anything?
Yeah, so quickly to add to it and to crystallize the two things, first of all, fix your sleep apnea. Whenever you're worried about travel when you've got a major healthcare issue on your hand. Second is if you travel with the machine. Lovely new machines have come in which are portable. It's very possible. Third, as my colleague said, don't take sedatives. Sedatives we forgot to mention is always a risk factor for worsening sleep apnea. Alcohol was already mentioned by Dr. Ramakrishna. And fourth is if you are in high risk, don't drive. If you have sleep apnea and you start driving on long highways and you're alone, the peace people are known to veer off the highways and fatality both to themselves, and they kill a few people also. And last but not the least, that if you're in a high risk occupation, air traffic control, pilots, nuclear reactors, anything, actually even surgeons for that matter, then you should be very careful of the fact that you may have low attention, you may fall asleep, and you may cause harm to yourself and to others. And to end with a funny story, remember that when British Airways came on their first class, and you have all these wealthy people and obese, and they were lying down flat and they were snoring away to glory. Someone who didn't have sleep apnea was paying for first class but could not get good sleep at night. So this was the funny travel story which was there before. So this, I think, crystallizes most of whatever we had to add for all these aspects.
Thank you very much, all of you. I think it was a really wonderful session, and I'm sure sleep apnea needs a lot more discussion and a lot more, information that needs to be shared. But for today, I think this is all we have. Thank you very much for participating.
Thank you. Thank you very much.